Hey there, back at you with your weekly news about coronavirus.
Coronavirus, what a week, Jackie.
What a week it's been indeed.
It's been exhausting.
Since we spoke to you last, we were not testing for the coronavirus.
We were not?
But
now we are?
Now we are, yes. So, what does that mean? Can anybody be tested? How do you get tested?
So, no, not everyone can be tested. You have to call in. We do video visits. So we send you a link. We triage you, either myself, Jackie, any of our practitioners. You'll talk to them on the phone. They'll ask you questions. They'll figure out whether you're high risk. And if you're high risk, we'll have you come in and do testing.
And testing is not in the office for anyone who's concerned. We are truly doing a drive-up test. So you park in the back of our buildings. We have your name and all your records. And then we usually will start with a swab for the flu. And then move on to the coronavirus.
We can also swab for strep. So, if you're a patient whose doctor's office closed and you think you might have strep, you can come in and we can test you for that too. So
definitely. Awesome. Why are we testing for the flu first? And if it comes back positive, not testing for COVID-19?
Well, first of all, flu is a lot more prevalent. So if you have a flu-like illness, it's more likely that you have the flu than COVID.
If you have a regularly scheduled visit at our office, maybe a wellness exam or an annual or a physical, maybe you can postpone those for now just to stay away from being out and about in the community. But alternatively, if you have a problem visit that you would like to come in for, but you're scared about coming in, you can arrange for that visit to be a video visit. So what you would do is call into triage, maybe state that you're having issues concerning a bladder infection or
joint pain.
And so that can be arranged that Dr. Beckmann or myself or any of our other staff members would perform that visit virtually through a video rather than having you come in and prescribe the medication through your video visit.
What are you doing with your OB patients?
So, great question. OB patients are still coming in. They are coming in for their regularly scheduled visits. We are not mixing them in sick rooms. They're in only OB rooms. And then I think if people have common complaints or concerns that can be video visits, we'll talk to them over the phone versus before patients would come in for anything and everything. There are some really cool apps that you can download to your phone, one being Bellabeat, where I don't believe it's Android compatible, but iPhone compatible. You can listen to the baby's heartbeat with your iPhone. So that's pretty cool.
I mean, iPhone's better, so.
Right, definitely. We both have iPhones. This is not a plug for Apple.
We were not paid by Apple.
Unless you want to give us free Apple products. We are accepting.
If they're listening, yeah.
Right,
yeah.
Yes.
So when an OB patient comes in, I mean, it's a happy time for a lot of people. They're pregnant, they're excited. They usually bring a partner in, maybe a mom in, maybe another kid. Is it just still business as usual?
So it's not. We really recommend that only you come to the office if you can. If you want your significant other to come to the visit, maybe you're having an ultrasound or some genetic testing today, then your partner can come to the office, pending that person is not feeling sick at all and has not been exposed to anyone with a positive COVID testing. And with that being said, when it's time to go into labor at the hospital, unfortunately a lot of hospitals have started a rule where only the person in labor plus one support person can go with them to the hospital. So just keep that in mind. Most hospitals are following that rule.
Sure.
So seems like we're kind of getting to the point where everyone knows somebody who was in contact with somebody who maybe tested positive. I work in the same building as someone who is positive. I heard that somebody in my neighborhood is positive. Where do we draw the line of, should I be tested? Should I be social distancing? What should I do?
So if you've been in direct contact with somebody who was COVID-19 positive, then you should quarantine a minimum of 2 weeks. If you walked in the same area as somebody who had COVID-19, but you didn't have contact with them, your risk of getting that infection is pretty low. So you're right. I mean, it's a tough thing to kind of trace because, I mean, in the community, it's everywhere.
Everywhere.
So, you know, you can't necessarily go in and get a test just because you heard about somebody that was in the store when you were there. You know, so I think right now the key is it's really that close, prolonged contact with somebody who's positive. So if you had a daughter or a family member or friend and you were hanging out with that friend for several hours and then you found out that that person became positive, then your responsibility is to quarantine yourself at least for 2 weeks. Not everyone that comes in contact with someone with COVID-19 needs to be tested. It's not going to change the management. By getting a test, you're not going to get better, you're not going to get treatment, you're just going to monitor your symptoms. It's more about, you know, if you had somebody that was COVID-19 positive, you need to take even more precautions. You need to isolate yourself, and if you start showing symptoms, that's when we would want to test you.
That brings us into our next segue of if I am not feeling so great, but I can't get tested for whatever reason. Maybe you're watching this video from another state that doesn't have great testing capabilities, or maybe you didn't qualify for a test with us. What does that mean?
So the good news is it means that we're not as worried about you. So, you know, if you called in to get tested and we decided, you know, you probably don't need a test right now, it means that right now you're not showing any symptoms that are worrisome. But we do want to follow up with you usually 48 to 72 hours later.
And if you're a person in another state or in another neighboring neighborhood that can't get tested but not feeling so great, have not spoken to us, we want you to follow the same rules of self-quarantine for 14 days.
The reality is if you're not feeling well but you're breathing okay and you're drinking and able to keep fluids down, then you just recover at home anyway. So it's really only the patients that start feeling really short of breath, they start feeling really ill, they can't stay hydrated, those are the people that need to go to the hospital.
We speak a lot about quarantine, self-quarantine, 14 days. What does quarantine mean?
You have to get a bubble and just like wrap
Bubble
it.
boy.
Yeah.
Next week.
I mean,
Dr.
roll
Beckmann,
around in a
boy.
bubble. No, I mean, it basically means that you don't want to be in contact, if you can, with anyone. So that can be hard for families, like if you're sick and you have children or you have a spouse. But that's the time where you pick a room in the house, and that's like your sick room, and people can like slide food into you, give you drinks.
But no human contact.
No contact.
Right.
Yeah.
So if you're not feeling good and you think that you are isolating yourself, but you are still going to the grocery store, but maybe not interacting with people or stopping at anyone's house, you're truly not isolating yourself.
No.
So the only way you really isolate yourself is if you are at home, in a room, or at your own home for 14 days without any contact.
Yeah. I mean, you can watch these videos when you're quarantined. I know they're engaging and exciting.
Very entertaining.
So, I mean, but no, for real, quarantine does not mean, well, I'm going to stay home and just kind of go quickly to the store or quickly to pump gas. No, I mean, that's when you get somebody else to shop for you, you get somebody else to fill up your car.
At the grocery shop.
At the grocery shop, yes.
Lots of times when you have a fever, you self-medicate with either ibuprofen, also known as Advil, or acetaminophen, also known as Tylenol.
Right.
What is the latest and greatest? We've been hearing a little bit about you should take Tylenol versus Advil. Right. Is that a real thing?
It is. So from what we know right now, it seems like the anti-inflammatory medicine like Advil or ibuprofen can actually facilitate the entry of the virus into the cells, and it can make pulmonary disease or pulmonary inflammation worse. So,
pulmonary meaning lungs.
Lungs, sorry. Yeah, thank you. But yeah, so even if we don't have a positive COVID test, if we think that you are likely to have COVID, or if we think that you need a swab, you should not take ibuprofen just out of an abundance of caution.
Okay. All this testing has us exhausted, but a lot of this testing is showing that people have the flu. And then their next question is, how long should I isolate myself because I only have the flu? Yes, the only time people are happy they have the flu.
People are happy to have the flu right now. It's kind of crazy, but so with the flu, if you come in early, like within the first 72 hours, we could give you Tamiflu. Tamiflu is an antiviral medicine. It shortens the duration of the flu generally by maybe a day. You don't have to take it. Some people decide to. But with the flu, typically you're going to want to isolate for at least a week. So even if you stop having a fever within a few days, you can still pass the influenza virus. So anyone that tests positive for the flu, we're usually telling them, even if you're feeling well in a few days, make sure that it's a week before you return to work or school.
A week from having a fever, or a week from symptoms?
So a week from symptoms.
Okay,
yeah.
So if you've had symptoms for 4 days, you test positive today, you're feeling better by Tuesday, you should be okay.
What's today?
Thursday. Today's Thursday.
Yes. Yeah.
Okay.
That should be okay.